Welcome back to part 3 of this series. For those of you who didn't see the previous videos, my name is Sagi Denenberg and I'm a veterinary behaviorist at Langford Vet. In this video, we are going to talk about the interplay between physical and mental health. Primarily, we are going to discuss about pain and cognitive decline and neurological effects that change behaviors. So, let's start with pain. Pain may appear as anxiety because the animal may avoid certain behaviors, such as avoiding jumping on the couch, jumping on the bed, may avoid exercise, going for a walk, or starting a walk and refusing to continue the walk. Pain may appear as aggression, where the animal doesn't want to be touched or doesn't want to interact or doesn't want to avoid certain triggers because of pain and therefore may show aggression. Now, acute pain is adaptive, which means the animal will try and avoid the pain, such as limping or trying to jump, because it may cause pain. And that's a successful response. However, when the pain becomes chronic, the response becomes maladaptive because the animal has to get used to it long term and develop strategies around the pain in order to continue the day-to-day function. That may cause more irritability, that may cause more restlessness, that can affect the sleep patterns of the animal, and it can ultimately alter relationship between the animal and its environment, such as owners, other animals, and exercise. Now, the behavioral changes could be learned after the fact, so you may solve the problem, treating the animal, treating the pain, using chronic pain control, for example, but the behavior may persist because the animal might be more afraid to repeat certain behavior. For example, if you have an animal with IVDD, and you may treat that, whether it's a surgery, whether it's medications, you may resolve the pain as a result of the IVDD, but if the animal learned that jumping on and off the bed causes pain, they will still refuse to jump off the bed because they don't know that you give them pain control. They don't know that they underwent a surgery to correct that. And there is still that worry, the anxiety, that if I do that behavior, it may cause pain. So even though you may solve the pain, some of the behaviors remain after the fact. And they can remain like that for the long term, weeks and months later, before the animal finally adjusts to the new set of behaviors where it's not so painful and I can resume some of those activities. So it's extremely important to remember that we need to assess both the physical, the pain itself, and the behavioral factors before we label certain avoidance-related behaviors or aggression-related behaviors or irritability-related behaviors as a mental disease or emotional disease, forgetting that it might be actually pain. Now, for example, aggression is one of the most common presentations that we see with pain because some animals don't want to be touched in a certain area. Say a dog with ear problems that doesn't want to be touched when they have otitis, and they might show aggression when you try and apply ear drops or examine the ear. Now, those are very simple cases to see because you reach towards the ear and the dog reacts to that. So in this case, pain can lower the threshold of reactivity. Some cases are a little bit more complicated and a little bit more challenging to identify because it's not specific location that you may touch, it's not an active infection or an inflammation that you can diagnose and treat that. That's when it becomes more maladaptive, as I mentioned in the previous slide. And that's when animals will start avoiding many contexts, such as play, interaction with owner. They don't want to spend more time close to other animals, for example, because they're afraid that certain behaviors will lead to pain. We have to remember that we need to evaluate all sorts of pains, not just musculoskeletal, which is the most common pain that we deal with, but you can have dental pain, you can have visceral pain, you can have skin-related pain, you can have neuropathies, and even phantom pain. In this case, what we really need to do is to observe the animal very closely and to evaluate gait and activities and tendencies, as in avoidance behaviors, a cat that suddenly doesn't jump as high as they used to, or they hesitate more before they perform a certain activity. There is no one test that you can touch the animal in a certain area or bend the joint in a certain area and elicit pain response. It's about behavioral observation. And one of the keys to remember here is that this behavioral observation at the clinic might be skewed because the animal is also more afraid. So it's also very important to educate owners to do some of it at home. because at home the animal may have less fear of the owner and less fear of the environment, and they are more likely to show more behaviors. And yet, if there are still deficits, those deficits can be attributed to pain rather than fear or stress that they experience at the veterinary clinic. So as I said, observe everything, the feline grimace scale, and owners can download an app of the feline grimace scale and do that at home. Make videos of different activities such as jumping on and off furniture, going up and down the stairs, laying down, getting up, circling. When you watch those videos later, you can slow them down. You can watch them by focusing on different body parts. You can do that before an activity, after an activity, before sleep, after sleep, and you get a far better indication of how the animal is doing and are there any deficits. For example, you can see animals that groom themselves less because turning, bending to groom certain areas may cause pain. Conversely, you can see animals that do that more. There is a direct positive feedback between compressing a painful part of the body and the release of endorphins and cephalins and dopamine. So, for example, a human with headache will massage the temples or will massage the wrist with wrist pain. An animal with pain may lick or gnaw on an area that might be painful. They may show head pressing against the wall if they have any sort of headache or increased intracranial pressure. So it's important to try and look for those. And those are very subtle behaviors that unless you educate owners to look for them at home, you're very likely to miss. At the same time, it's important, and as you see in future video, it's important to rule out behaviors that animals show from other physiological diseases such as licking painful area as a result of pain versus a result of skin problem or a compulsive behavior. Always ask the owner how the animal is doing at home, because owners will tell you they know their individual animal behavior better than anyone, and they will tell you that Fluffy is not himself. Fluffy is acting differently today. And it's important to take that and to understand that even though they cannot point and tell you why, or they cannot give you any specific clinical sign, such as Fluffy is vomiting, they still know that something is not right. And when you see that, pain should be on your top list. Pain should be there as one of your primary rule-outs. Now, the pain could be localized, just a joint, just an ear, or it could be more systemic. Localized pain is based on reflexes, it's based on nociceptors in the area, and it's mostly about avoiding the behavior. Don't step on a painful foot, for example. Touch something hot, you retract your hand as a reflex. It doesn't get to the brain, there is no systemic response. But once the pain becomes more chronic and become more generalized or systemic pain, that's where the emotional system, primarily the limbic system, starts responding to that. And that's when you start having more changes in neurotransmitters. That's when you have more changes in your HPA system, for example. So there is more cortisol processing, and that will start affecting your behaviors. Animal will become more withdrawn. Animals can become more irritable. It might affect their sleep-wake cycle. It can affect decision-making. For example, an animal that is faced with fear has the decision of flight or fight. But an animal in pain may not have the flight option, and therefore you will have the fight option. So once the pain becomes more systemic, there will be more widespread influences on the behavior of the animal. Chronic pain sensitization blurs the boundary there, and it's really challenging sometimes to find out, is it behavioral, is it medical? So in some cases, pain control trial is what we need to do. Now, it's important to remember that while you give the animal, for example, non-steroidal, the pain might be gone within hours. The knowledge that certain behaviors may cause pain can take weeks to months to disappear. So doing pain control trial is not enough to do for 1 week or 2 weeks. The minimum you should do that is about 6 to 8 weeks. And if you see no difference after 6 to 8 weeks, keep in mind that it may not be that the animal is not in pain. It's very likely that the pain control that you chose wasn't the right one for this individual animal. So if you chose one NSAID and you get no response after 6 to 8 weeks, it is still worth to try a different NSAID or a different category of pain control, opioids, NMDA antagonists, for example. don't rule out based on one trial. With musculoskeletal disorders, those are somewhat easier to diagnose. We can see the changes, we can do testing, force plate analysis, imaging. There are more that we can do, for example, to rule out or confirm pain in those cases. But musculoskeletal disorders can affect the mobility, can affect the animal's interaction or desire to play, desire to go to the litter box, desire to go out for a walk, for example. It can affect sleep-wake cycle, and of course cause more aggression. Now the next part is the effect of the nerve system, and we're primarily talking about the brain right now and behavior. Clearly there is a direct connection there. The brain produces all behaviors. So any disease that will affect directly the brain can also affect the behavior. So there are many neurological disorders that will produce those changes, starting with tumors, infectious diseases, metabolic diseases, degenerative diseases, blood circulation diseases, and so on. So it's extremely important to have a full neurological evaluation once you get an animal with changes in behavior. You do your full neurological, gait, reflexes, everything that is going with menace reflex, for example. And of course, we want to look at the cognition of the animal. Can they remember things? Can they respond well to signals that we give them? Do they forget certain behaviors? Of course, as part of that, we need to ensure that you do a full sensory evaluation. Eyesight is relatively simple. Smell, we can test that. Hearing is a little bit harder because animals, when they're stressed, while their hearing is working, they can't really perform what you ask them to do. So you can call it selective hearing, or you can call it a problem in executing behaviors that you ask them to do. And even if we can do the brain auditory evoked response test, it may tell you that the pathway is working well, but it doesn't mean the animal actually hears you. So hearing might be a little bit more difficult, but doing simple observations. Your animal doesn't respond to any signal that you tell it right now, but if you open a can of food or if you open a bag of treat, the animal comes running, well, clearly the animal can hear. In this case, this kind of selective hearing could be due to anxieties or fear where the animal might be frozen and refusing to do something. On top of that, we have to consider that while unlikely or very infrequently, some behaviors might be actually seizure-related behaviors, certain behaviors that may appear compulsive behaviors, maybe seizure-related behaviors, so we need to look into that. We need to possibly, in some cases, do an anticonvulsant trial. That could be certain behaviors in a cat, like feline hyperesthesia, for example, certain compulsive behaviors in dogs that may look like a seizure. And in some cases, we need to run a trial. But as I mentioned about the pain control trial, running a trial with anticonvulsant should be long enough to ensure that we gave enough time to see if the behavior disappears. So just as an example, if an animal has an odd behavior once a week, running 2 weeks anticonvulsant trial may not be enough because we might miss that behavior or it just happened to not happen. So you need to run it for longer term. And if it doesn't work, it may be that the anticonvulsant that you chose wasn't the right one. So you may have to try another anticonvulsant after that as well. So an animal comes, odd behaviors, do your basic physical exam, do your neurological exam. If necessary, you might need any imaging, starting with basic imaging or more advanced imaging later, such as an MRI. In some cases, you might even need a cerebrospinal tap and analyze that. And of course, you need to do any lab testing, blood tests, hormonal testing, etc. Now, you do need to have an assessment done, but as I said, the assessment in the clinic, of the gait assessment in the clinic might be flawed because of fear. So ask for videos from home, ask for pictures from home, see how the animal behaves in an environment that is more familiar, more relaxed than the veterinary clinic itself. Cognitive dysfunction is somewhat newer presentation that we have. It's only in the past 25, 30 years that we started paying more attention to cognitive dysfunction. That's due to the advancement in medicine, MRI technology, better diets, so animals live longer, better ownership, and now we start seeing them more and more like we see with people. Cognitive dysfunction is a neurodegenerative progressive disease. In other words, we cannot stop it and it will continue to escalate over time. However, we can help. We can minimize some of the impact that it has on the animal, and we can improve the life quality. There are different ways or different scales to look at cognitive decline. One of the most common scale is the DISHA, and sometimes just DISHA. That stands for disorientation. So the animal may look confused, walks into a different room, looks at its surrounding, not understanding how it got there, or aimlessly walking in the room without any specific goal or purpose, not looking for food, not looking for the owner, just walking aimlessly. Or it's an animal that knows the door opens to the left, but yet they still stand at the right side where the hinges and wait to be let out, for example. I stands for interaction. Like I said in the previous video, you always want to know how the animal was before and how the animal is now. It's not always more interactive or always less interactive. You always compare the animal to the animal before. So if a dog used to be more interactive and now the dog is less interactive, if the dog used to be more aloof and withdrawn and suddenly the dog is more friendly and outgoing, you always compare the animal to itself. Any changes of interactions can be due to that. Sleep-wake cycle. The animals start sleeping more during the day, less during the night, for example. Now, house soiling is just an example of forgetting behavior. It's not specific to house soiling. It's forgetting where the food is. It's forgetting certain signals that they know, like come, sit, go to your place. It's just that many owners are very likely to miss the fact that their dog forget where it's his favorite bed, or that they forget to eat from time to time, but they will not miss the fact that the dog started soiling in the house. So we use house soiling just as an example for forgetting known behaviors. This is where cognitive decline is much easier to diagnose in working dogs, bomb sniffing dogs, eye-seeing dogs, because their behavior is shaped so well. So any deviation from their normal behavior, from their normal training, considering that that's what they're supposed to do, is much easier to pick. The pet dog, the companion animal dog, it's sometimes harder to pick up on forgetting behaviors. A stands for activity. A dog that used to be very active, no longer active. A dog that never used to be active, now very active. And as I said, in some scales, there is another A, and that's anxiety, that the dog develops more anxiety. In cats, we have a similar scale, but we usually add a V for vocalization. Those cats become more vocal. Now, we don't have a test today that can confirm in vivo cognitive decline in dogs, because the only way is to get the immunohistochemistry of a brain tissue from the area of the hippocampus. And we cannot do that, and the patient survived this kind of biopsy. So the only test today that we have is post-mortem. Therefore, it's an exclusion diagnosis. You would have to rule out a long list of other pathologies that can contribute to the signs that I described before we can say it's cognitive decline. Because you can have a dog that becomes more active because of anxieties, because of certain diseases, or you can have a dog that is less active because they have a heart disease or kidney disease, or you can have a dog that is eating more than before because of diabetes, or a dog that eats less. So there is a long list of other diseases that you would have to rule for your physical examination, neurological evaluation, any imaging, any lab test. And if you ruled all of those out and you look at that scale, the DISHA, and you start picking more and more signs there, then you have a presumptive diagnosis of cognitive decline. Now, an MRI is very useful, and like you can see in this MRI image in front of you, what you see there is that there is a loss of brain tissue. And in this case, what you see as the black space is the third ventricle that is much wider than it should be. The problem with the MRI is that unless you do an MRI every year and you can compare them, you don't know if what you see is an accidental finding or it's truly due to cognitive decline in dogs. So remember, the diagnosis is presumptive, so there is a long list of things that you need to rule out first, and then you can treat cognitive decline and see if your treatment works. One of the things to consider is that it can happen in any dog usually over 6-7 years of age. We start seeing that in the larger breeds. In the smaller breeds, maybe around 9-10 years of age. I tend to give owners questionnaires. And I say, print the questionnaire at home, fill it, and tuck it in a drawer. Very simple, yes or no. Is your dog showing this? Yes or no. Is your dog showing that? Yes or no. Now, 3 months later, I say, print a new one. Don't look at the result that you filled from 3 months ago. Print a new questionnaire, fill it, tuck it in a drawer. 3 months later, or 6 months in total, print a third one and repeat the process. Because it's a chronic, progressive disease, you will see those changes. And we know through epidemiology that the signs of cognitive decline increase with age, both the severity of the sign and the number of the signs. So by following that over 3-6 months, you will get a better idea if the animal is progressing. Now, what actually happens with cognitive decline? It's a brain aging process. Now, there is normal aging and there is abnormal aging. In this case, it's abnormal aging. Part of the problem is due to blood circulation in the brain that reduces. It could be due to heart disease, it could be due to kidney disease, it could be due to vascular disease. But the net result is that you have less oxygen and less glucose reaching the brain. And as a result, the mitochondrial function in the brain is ineffective. And the mitochondria, instead of using proper oxidative processes, it starts producing more oxygen radical species that cause damage to the surrounding nerve cells. And those nerve cells basically deteriorate and die. They cause a lot of damage to the phospholipid membrane, and then the cell dies. So we lose brain matter, like you can see in that MRI. So that's one of the problems. The other problem is that you don't have enough glucose for metabolism, and you start producing more ketones, for example. Now, the metabolism of protein as a result is altered, and you start producing more proteins such as beta amyloid, which is an inherent protein that is too big to move, has no actual function in metabolism, and it just accumulates in the cell. And once there is too much of it and the cell can no longer contain that, the cell bursts and dies. And what we see in those immunohistochemistry that I mentioned earlier, you see those plaques of beta amyloid accumulation that causes the damage. Remember that cognitive decline or cognitive dysfunction syndrome is a neuroprogressive disease. We cannot cure it. It will continue to escalate, but we can help slow it down and we can improve a bit the life quality of that animal that suffers with it. But early detection and early intervention and relatively aggressive intervention can yield satisfactory result for that animal, for that owner. So it's important to ask, it's important to observe those signs, it's important to use questionnaires, and as soon as you see that, the use of multimodal approach is very successful in slowing down. You will not cure it. It's important to be realistic. It's important to tell the owner that, but you can slow it down. We use medications like monoamine oxidase inhibitors, like selegiline. We can use diets that's supposed to improve metabolism of glucose. So for example, the Purina NeuroCare is based on usage of ketones instead of glucose, or the Hills BD diet is supplemented with antioxidants. It's supplemented with neuroprotectants that can help the brain. So as long as the individual animal doesn't have any other metabolic diseases that require a different diet, feeding them one of those two diets will be very helpful. But one of the single most important things when managing cognitive decline in dogs and cats, it's enrichment. We are talking about feeding toys, we are talking about training, we are talking about taking them to new environments so their brain is working. Think of the brain as a muscle. Use it or lose it. And that's extremely important and relatively simple thing to do. Use feeding toys and training, both dogs and cats. Of course, there are all kinds of supplements that are based on antioxidants such as SAMI and medium-chain triglycerides that you can use. There are other products that contain ginkgo biloba and resveratrol that you can use. But the mainstay should be appropriate diets, monoamine oxidase inhibitors like selegiline, and enrichment. It's important to evaluate the animal to see how the treatment is working. It's important to adjust when necessary, maybe increasing the medication. And of course, there are other supplements or other medications that we can use For example, you can use propentophyllin that's supposed to help with the circulation in the brain, and there are other supplements or medication to use in those cases. Now, in the next video, we will discuss how different physiological diseases in the body contribute to various behavioral presentations.